So dear students, we will discuss a condition which is seen in the oral cavity, may not be that common. You know that carcinoma is the commonest condition which you come across in the oral cavity, which is the commonest malignancy in India, and especially in the middle and south India, because of the tobacco chewing, where this is the different entity, but in the oral cavity. Just see that, see here, see the tongue is here, this is the upper lip, this is the palate here. In the case of palatal perforation in the palate, so many causes. Nasal and oral cavity communicates here through this perforation. So again, nasal cavity is there inside, so it communicates. So causes are so many causes written here: congenital, infectious. This is the one which is very common: gumma, syphilitic gumma, tuberculosis, leprosy. Noma is suppurative stomatitis. You know that. Destruction, it is phagedena, you know that, destruction without proliferation, very destructive infective condition, noma. Olden days very common in the young individual, now because of the antibiotic increase in nutrition, condition has come down. Still it is where poverty is there, still it is known entity. Osteomyelitis can cause autoimmune palate, autoimmune disease, smokers, neoplastic condition, carcinoma palate can cause, iatrogenic drug abuse, cocaine and biphosphonate can cause this palatal perforation. Now features are they're painless, solitary, single, deep punched out ulcer that perforates the palate. See that punched out ulcer which has gone there, punched out. It can go so deep and opened, perforated the palate actually. It can be neoplastic, mainly palatal carcinoma, and minor salivary gland tumor is common in the palate, all of you know that. And adenocarcinoma of this condition, minor salivary gland can be very aggressive and perforate the palate, but doesn't look like a neoplastic. See that? It's either post radiotherapy or infective condition, or sports surgery, whatever it is, wide excision might have caused osteomyelitis and perforated that. So all the different process possibilities are there. So history is important, previous surgery, history of biopsy, how far it is, history of infection, history of sexually transmitted diseases, exposure history of, so, and how nasal problems. So all these typical histories are important to identify these things. And the treatment is, if it is non-neoplastic, local palatoplasty will suffice to cover it. Otherwise, if it is neoplastic, then take biopsy, CT and MRI of the head and neck region to find out the base of skull and other areas. And depending on situation, wide local excision, reconstruction of the palate, and of course, eventually chemotherapy, chemoradiotherapy, whatever, depending on the type, grade, and the extent of the neoplastic disease as such. So this is the one I just wanted. Syphilis you have to keep in mind, even though it is not common because of the penicillin usage. Still you have to keep in mind iatrogenic, malignancy, then infection, congenital entity. All those things are the different causes which you have to remember when such a patient you come across. So management already told: biopsy, palatoplasty, bone graft, osteomatis, antibiotics, succorsectomy. Gumma should be treated by penicillin. Syphilis is the treatment of penicillin is the treatment of choice. ATD, noma is again antibiotic reconstruction. Drugs which causes this cocaine like condition can cause. So rehabilitation is important. So malignancy, surgery, RT, chemotherapy, different things you have to remember in a palato. This one treatment is palatoplasty if it is a non-neoplastic condition. So answer the MCQ. A healthy 20-year-old male presented with the hole in the roof of the mouth with nasal regurgitation of food in 6 months. The male otherwise healthy. What abuse history would you ask? Tobacco, cocaine, morphine, alcohol. So find out the right answer and get back to you. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember. And many photos of most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn very basics is the required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB Operative Surgery Atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very, very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB is Atlas of Tissue Approximation, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very, very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. If your daily lectures are there, live sessions are there. My digital lectures through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.